Last month, authorities at the Hoima Regional Referral Hospital launched a blood donation campaign in the Albertine region following reports of blood shortage there. Blood shortages are reported at least every year in different parts of the country. Uganda has an annual deficit of 150,000 units compared to what is recommended by World Health Organization.
There are shortages, yet we require up to 450,000 units of blood annually. What does that mean? We are only able to collect up to 2/3 of blood, and yet the demand is increasing. The disease burden is stretching us.
According to Dr. Charles Olaro, the Director of Clinical Services at the Ministry of Health, children consume most of the blood as a result of malaria and other conditions related to anemia. Dr. Olaro says there is a need for early diagnosis to prevent such cases.
And recently you recognize that we had an upsurge of malaria. That's why government and partners has invested in the prevention of malaria. Most of our mothers are anemic, so that by the time they deliver, even if they lose very little blood, they will require what? A blood transfusion.
However, challenges such as malnutrition hinder efforts to secure adequate blood as a number of potential donors are turned away due to their nutritional status.
Generally, people are malnourished. When we go to pick blood from a given population, some individuals, and a relatively big number, is not allowed to donate because they are anemic. We have adult anemia, chronic anemia in the population.
The Uganda Blood Transfusion Services has attributed blood shortage partly to reports of health workers selling blood, whereas the public donates this product.
Maybe this is what is causing our underperformance by not getting, because when we collect free blood from volunteers, and when they end up in the hospitals and buy this blood, then next time when we go to them to ask them to donate blood again, they will say, no, I can't give you my blood free because when I went to hospital, I was told to buy blood.
The matter of selling blood has attracted the President's attention, prompting him to direct the Ministry of Health to investigate this matter.
What we understand in private healthcare facilities is that many times the charges are towards the blood cross-match and the blood transfusion set, which is used to administer blood. So at times, patients tend to misinterpret this charge. But there are other times when we have witnessed when blood is sold by healthcare providers.
Uganda Blood Transfusion Service officials say health facilities often do not account for the previous usage of blood, which raises queries.
Because at times, this blood is taken elsewhere, taken to other healthcare. That's why they don't want to account. At times, they don't have transport. At times, the ambulance doesn't have fuel. At times, there's nobody to come and pick blood.
According to Ministry of Health, demand for blood is continuous, given its 30-day shelf life. Government has called upon the public to join the blood donor drive, donating at least twice a year to save a life. NOBERT ATUKUNDA, NTV News.